Hi everyone, this is Anita Gill, board certified dermatologist in the Woodlands, Texas. Today we're going to talk a little bit about platelet-rich plasma injections for hair loss. Here you can see we're actually drawing our lovely patient's blood so that we can actually centrifuge it and separate platelet-rich plasma from platelet-poor plasma and red blood cells. So here you can see it's going in the centrifuge. We typically draw one tube of blood, about 22 ml, for hair loss patients. So now it's done, and you can see it's been separated. The gold part is our platelet-rich plasma, which is full of growth factor and cytokines, which is actually what is injected into the scalp. In the next clip now, you can see that we are drawing all the platelet-rich plasma into syringes to be injected into the scalp. I typically like to inject 9 to 11 mils in the scalp, depending on what the yield is, but I typically like to do that, and I space it every month, 3 to 4 times, and then I try to maintain twice a year. So here you can see we also call this liquid gold because platelet-rich plasma has lots of growth factor, cytokines, and when injected into the scalp, it can really promote hair growth. Here you can see the injections being started. I like to inject in the second layer of the skin, the dermis, where the hair follicle originates. I space out the injections about 1 to 2 centimeters apart. I use a little vibrating device. That's what you're seeing me inject it with. It's called the New Vibe. It helps distract patients as we're injecting. So I'm following along the hairline here. This patient in particular has female pattern hair loss. And there's lots of different types of alopecia. Alopecia is just a broad name for hair loss. You can then branch it out into scarring and non-scarring. Non-scarring includes female pattern hair loss where you have more of a receding hairline and then the midline part is widened over time. There's also less hair in the vertex or the crown of the scalp. I also like to combine this treatment with vitamins, occasionally spironolactone or finasteride, which are off-label for this kind of hair loss. And then I also will recommend Rogaine if the patient can tolerate it. Here we're at the end of our injections. We're injecting the last 2 mils. And I try to go as superficial as possible because I find that it helps the most. As far as what to expect after the treatment, you're going to have a little bit of discomfort. Maybe for 10-15 minutes after, your head's going to feel a little bit full. After 15-20 minutes, you're really not going to feel anything. You can take some Tylenol if you're uncomfortable. You can also wash your hair 6 to 8 hours later with sulfate-free shampoo. But there's really not a lot of downtime from this. If you have questions, please give us a call, 281-853-5308.